Hello and welcome to the Cardiac Rehab podcast. My name is Julie and I'm one of the nurses with the team, and today I want to try and answer some of your questions about leaving hospital in the first few weeks following a heart attack. The advice is fairly general and will relate to most of you, but if you do have any other questions that I've not covered today, please comment below. Question 1. I've been prescribed lots of different medications. Will these be lifelong? Many of the tablets you are prescribed will need to be taken for the rest of your life, and it is really important that you take them every day, even if you feel well. They will work in different ways to reduce the risk of you having another heart attack, protect your stents from blocking, prevent or treat angina attacks that can sometimes happen even if you've had treatment, help to strengthen your heart, reduce the risk of other heart muscle damage, lower your cholesterol level if it's high, and protect your arteries from further narrowing. If you have any worries about side effects from your medication, please don't stop taking them. Just keep a diary of the side effects that you may have and discuss this with your GP or pharmacist, as they may be able to recommend alternatives. You should have been given a month's supply, so please request your repeat prescription at least a week before you're due to run out, to allow your GP and pharmacist time to set everything up for you. Question 2. I am worried that I might have another heart attack. It is a frightening time when you first leave hospital, and you're certainly not alone in feeling this way. Any treatment you may have had and your medications will help to reduce the risk of having another heart attack. But it is important that you do not ignore symptoms that you feel are getting worse. Most people would have been prescribed a GTN spray and given advice on how to use this in the event of developing symptoms. As a reminder, if you get any chest pain or discomfort that suddenly occurs and doesn't go away, it may feel like pressure, squeezing or heaviness in your chest. Pain may spread to your left or right arm, to your neck, jaw, back or stomach, or feeling sick, sweaty, lightheaded or short of breath. You must stop what you're doing, sit down and use your spray. That is 1 to 2 squirts underneath the tongue, and wait for 5 minutes. If the discomfort starts to subside, just sit and rest for as long as needed and carry on once fully recovered. If, however, you feel no relief, repeat 1 to 2 sprays under the tongue. Wait another 5 minutes, after which time you still have ongoing or worsening symptoms, you must call 999 for urgent medical attention. Do not ignore these symptoms or try to take yourself to hospital, as the ambulance crew are much better equipped to get you assessed and treated quickly. Do not worry about taking this action, especially with concerns over coronavirus, as the hospital have the best systems in place to treat you safely and quickly. Question 3. How much exercise and activity should I be doing? When you first get home, you probably won't feel like doing much at first, so take it easy, catch up on your sleep, but do try and get yourself up and dressed, even if you don't feel like it. Build up on your activity gradually, doing everyday things such as making yourself a drink, doing light housework such as washing the dishes and keep active, walking around the house, or using the stairs if you have them. If you have a garden or outdoor space, try to get some fresh air and do some light exercise daily. At this time, the government are advising us only to go out once a day for exercise, and this is a good idea. Just stick to open spaces and avoid areas where there is a lot of people. Build up your walks gradually over the first few weeks, going at a comfortable pace which makes you slightly breathless, but you're still able to talk normally. The cardiac rehab team can advise you on increasing your exercise levels and will recommend a suitable home-based programme to help you progress further. Can I still drive after a heart attack? You will be advised by the doctor or nurse when you can return to driving. This is dependent on the severity of your heart attack, how it's been treated, and if further treatment is required. If you've had a stent fitted, there are no plans for further treatment, and you've had a test called an echocardiogram which shows the heart is functioning well, you can drive after 1 week. However, driving can be restricted for 1 month if you have not had a scan, there have been complications, or you need further treatment. If you're not sure, please ask the cardiac rehab team, who will be able to guide you. If you hold a HGV or PCV licence, you will need to inform the DVLA, who will then confirm when you can return to driving lorries and buses. Taxi drivers will also need to contact the council who has issued their taxi licence and follow their advice on when they can return to work. In all cases, it's advised that you contact your insurance company just to let them know that you've had a heart attack. This should not affect your premiums. Am I at increased risk of getting coronavirus after my heart attack? Having a heart attack will not increase your risk of contracting coronavirus, but might mean that if you do catch it, you become more at risk of serious complications, which puts you in a high-risk category. It is vital that you follow the guidance and stay at home to protect yourself, going out only for essential needs. You are particularly high risk if you are over 70, have had a heart attack, have angina that restricts your daily life, heart failure, especially if you've needed hospital treatment, or any history of heart surgery or cardiomyopathy. Other conditions and risk factors also put you at high risk, such as diabetes, high blood pressure, obesity and smoking. So this is a great time to improve your well-being and make any lifestyle changes that will help not only to reduce your risk of further cardiac events, but also the complications of COVID-19. I have been feeling really anxious since I came home. Is this normal? It is really common to feel anxious, worried or frightened after a heart attack, and it is a natural response to a life-changing experience. For most, this usually eases off as you come to terms with your condition and how to manage everything that comes with that, such as making lifestyle changes like stopping smoking and getting into a new routine of taking daily medications. But if these feelings carry on for longer than usual and start affecting your quality of life, you may need to get support. When you're anxious, it can lead to feeling afraid to do things you used to, or avoiding them altogether. It can make you overthink things, going over and over it in your mind, which can then affect your sleep. You might feel nervous or find yourself constantly worrying. If any of this sounds familiar, there are lots you can do to help yourself. There are many things that you can do to help yourself, and the things that are known to help can be by getting active. Go out for a walk or do some gardening. We know that activity can really help to reduce anxiety. Eat a healthy, balanced diet with plenty of fruit and vegetables. Try to eat regularly, ideally breakfast and a small lunch and dinner. Avoid foods that will cause your blood sugar to rise and fall rapidly, such as chocolate, biscuits and sugary drinks, as this will cause your energy levels to slump. Choose slow-release foods such as whole grain bread, rice and pasta instead. Keep yourself hydrated, aiming to drink 6 to 8 glasses of fluid a day. Water is a cheap and healthy option, but tea and coffee and juice will also count towards your intake, but be aware that these may also contain caffeine and sugar. Talk to someone, family, friends or someone from cardiac rehab. If you can confide in someone, please do, as it is often a worry shared is a worry halved. Spend time doing calming activities such as reading, crafts or puzzles. Maybe use the time to take up something new. Write a worry list, then set yourself some time each day to go through it. Quite often when you come back to it, you may realise that there's nothing to worry about, but if it is still causing concern, try to find a solution. It might be a practical problem that needs sorting, but if it is something that you can't control, cross it off the list. Avoid stressful situations when you can by saying no to anything that increases your anxiety. There are lots of meditation videos and mobile apps that can be used at home. These techniques can be really helpful, but often need a little bit of practice to do. So please persevere with them. This is a simple breathing exercise that you can do to help when you're feeling anxious. By doing this, you can calm your thoughts and overcome your feelings of panic. So we'll just take a few moments now, sit quietly, nice and comfortable, close your eyes if that feels better. I want you to do nothing but think about your breathing. And as you let your breath flow as deep down into your tummy as is comfortable without forcing it, try breathing in through your nose and out through your mouth. Breathe in as gently as you count steadily from 1 to 4. Then, without pausing or holding your breath, let it flow out gently, counting from 1 to 4 again. Repeat this a few times, then return to your normal breathing pattern. By doing this simple exercise, it can really help to calm you. There are lots of these type of exercises available, and we will try to show you them as best we can. Thank you for listening.